Lupus, everything you need to know. This is a very bad thing here, and I notice there's not much on it anywhere. So coming from a lupus patient, I'm going to explain a little bit about it for y'all so I don't get those awkward patient zero remarks or feel like I'm patient zero. Lupus is an autoimmune disease. The immune system, which normally protects the body, turns against itself and attacks it. Lupus has no known cause, and as a result, no cure. The disease can affect many different systems of the body, and there are many different ways that it can affect people. It's basically saying there, you cannot catch it. It is not catchable. It is hereditary. That means if I have it, I can't just pass it on to you. Lupus can be both a chronic and acute, but a patient can experience acute episodes, times when symptoms can worsen immediately, abrupt, and occasionally severe ways. These are acute manifestations known as flares and can often occur this way even those who have had the disease for many years. Now, lupus is basically, back in the day, they didn't really know what it meant very much, but they call it lupus, and the disease got its name because many patients looked at it as though they had been bitten or scratched by wolves. Lupus in Latin means wolves. Basically, they don't know nothing about it, and they give it a broad term. Lupus covers a million different things that could possibly happen. I mean, a lot of things can happen when you have lupus. Now, I'm going to quick skip ahead here and let you know a little bit of the symptoms of lupus because it is quite fascinating, really. The most common symptoms of lupus are ulcers in the nose and mouth. Other symptoms have been associated with it are weight loss, anemia, sun-sensitive rash, Raymond's phenomenon. The toes and the fingers turn red, white, and blue because spasms in their small arteries stop the blood flow. Inflammation of all the membranes around the lungs, hearts, and abdomen. Seizures, inflammation of the wall of a vein, recurring miscarriages during pregnancy, psychosis, a pathological mental disorder marked by loss of contact with reality, and kidney inflammation. What are the categories of lupus? General symptoms: weakness, fatigue, low-grade fevers, general aching and chills. Skin problems include rash, patchy lesions, red inflammation, scarring on the scalp may occur and cause hair loss. There you go, it does cause hair loss. Chest symptoms involving the chest include chest pain due to pleurisy or pericarditis. That sounds severe. Both of these conditions may cause difficulty breathing, pain, shortness of breath, rapid heart rate, inflammation of the rib area, and the abdominal muscles may cause chest pains as well. Muscular system. Symptoms include weakness, aches, and pains. Joint symptoms include arthritis, pain, swelling, redness, and stiffness. Blood symptoms include low blood red cell count, decreased white cell count, leading to increased susceptibility to infection, increased amounts of gamma globulin, and a false positive test for syphilis. Ain't that something new? I did not know that. Cardiac or cardiac or circulatory system symptoms include a swelling of the extremities, accumulation of the fluid in the sac surrounding the heart, and Raymond's phenomenon. Digestive symptoms include stomach pain, cramps, nausea, vomiting, diarrhea, and constipation. Decreased kidney filtration efficiency leading to uremia, increased waste products remaining in the circulation. Another symptom is proteinuria, excessive amounts of protein loss in the urine. The nervous system. Various parts of the nervous system, including the brain, spinal cord, and nerves, may be involved. Symptoms include headaches and, in more severe cases, seizures, temporal paralysis, psychotic behavior, or stroke. Now, this is the problem with lupus. It is so hard to diagnose. It is hard to catch. And doctors think you're freaking nuts. And symptoms vary from person to person. No one knows why the symptoms vary. It's probably because every person is different. And, for example, anyone can have any amount of these symptoms. They can be all kind, and it causes swelling of the joints. There's a whole bunch of stuff that can happen with it. For example, I get these welts all over my skin. Red, ugly, painful welts, and people look at me like they can catch it or they're infected by me. That's one of them. And as you can tell, my ankles and my feet are extremely swollen. And you can see the bubbles on my calves. All those indentations and bubbles, that is from the swelling. I am actually extremely small, but because of the swelling, and you can tell on my second toe, see the knuckle on that second toe? See how fat it is? I'm actually quite small. It's quite smaller than I appear. My clothing sizes can range from a size 13 jeans to a size 20 jeans, and it can happen as quickly as a day. And those red welts they hurt, and they're all over. They get on your face, they get on your arms, your chest, everywhere. And the sad thing is people look at you like you're diseased or you're disgusted, and doctors think you're crazy. And your lupus flares can lead to a loss of muscles. You can, besides the loss of muscle, there's so many more things. You can get arthritis, you can get fibromyalgia, tenderness. There's such a broad term here. Kidney problems, lung problems. You'll get fluid buildup in your lungs and in the sac around your heart, and it hurts. And your skin symptoms of lupus, a lesion, a rash, discoidal lesions, blush rashes, mylar facial rashes, blood vessel lesions, and I mean spider-like little marks in the skin. These are disgusting and they look ugly. And not only that, I'm facing hair loss, and I have the problems with my nose and my mouth, and it can have lesions in the nose, mouth, or vagina, itchy hives, tightened skin on the hands and feet, pigment loss or gain, calcium deposits in the skin, fluid-filled blisters. See, they're not pimples, they're fluid-filled blisters, y'all. And this sucks. This really sucks. I get looked at weird every day. And for the last 5 years, I was dealing with all this stuff. And another thing, I'm dealing with the hair loss right now. And basically, when I was high school, middle school, I had extremely long, extremely thick, curly, like unruly curly hair. I had to have it thinned. That's how thick it was. Now, there's almost nothing left on the top of my head. And as hard as that is to deal with, I still have to go out and be around people and have these marks all over my skin and my face and my chest that I can't hide. I feel so much pressure in my body because it's so filled with fluid. And the worst part about it is, sometimes I don't know what's going on. I lose touch with reality and I don't know who people are. I mean, I've lived in the same place for years out in the country. I drove to town one day and I called 911 on my way to town. And y'all need to hear that 911 call, because let me tell you something. It is awful. I even felt sad for the person on that recording. Then it would find out it was me. Oh, God, it's all calm. And then all of a sudden, for the end of it, I'm crying hysterically because I can't figure out where I'm at. I was having sex with my husband. And I started screaming, where's Travis? Where's Travis? Where's Travis? Because I didn't believe the person who I was having sex with was my husband. I was lost. I switched my sister cars one time because mine had a little problem. I have a 2012 Honda Civic and she has 2014 Ford Fusion. Well, I walked out of the gas station one day and I called the cops because I thought somebody stole my car. It's ridiculous. And you know what else it is? It's even harder because when I go out in the sunlight and people see me, the sun can change the way I look and it can cause a lupus flare-up. And then there's so many things that I have to go through on a daily basis with this disease. The fact that I was looked at like I was crazy for 5 years while they were trying to figure it out. And fluid retention. And the kidney problems that I'm having. And it's so painful. And you know, when I sit here and I think about it, I have to go through all that. And then miscarriage. I had a miscarriage and I lost my child and my marriage was ruined. This is all before they diagnosed me with lupus. This is all before. And then I have to deal with my hair falling out, this ugly skin lesions, gaining all that weight, come to find out it's fluid, getting told I had hypothyroid disease, this, that, and the other. Nothing. I'm just doing this. Hold on. I'll be out in a minute. I'm finishing my face. What one thing? Don't put it in the water. Take a hot rag with hot water and soap on it and wipe off the grill.
Oh, okay. I was asking how you did that.
I'm sorry. Yeah, just wipe it off. I have to deal with all that. My hair falling out, being extremely huge, and being looked at like I'm crazy for 5 fucking years while I go into the hospital and trying to figure out all this stuff, and waking up in the middle of the night and not feeling right, and ended up having a police officer escort me to the hospital because I didn't even know where the hospital was, and then pointing me all to the mental health professional when all along it was this. And then I have to deal with the fact that my marriage is ruined because of all that. And you know how awful I feel whenever I start feeling icky, because I can feel it coming. I can feel it coming because my feet will start swelling and getting fat. So my ankles, like they are currently, and you can see the like puffy marks in my legs. You can see it because I can see it like right here, right here, right here. That's all because of my kidneys. The swelling. And I probably should have went to the emergency room yesterday, or the day before, when all the pain in my back started. You want to know why I didn't? Because they make fun of me there. Doctors assume they know everything. Come to find out, for 5 years I've been dealing with this, and they just thought I was crazy and told me that the things that I was describing, the symptoms I was describing to them, was impossible. I donate blood because I'm O negative, and I have a problem with my iron when I donate blood because it's a lot of times really too low. Come to find out, I am a 13.9 on one hand, and on the other hand, I'm at a 7. And then I tell a doctor that, and he tells me I'm crazy and that didn't happen, yet it did, because I donated blood and they checked both of my hands, and it was that drastic. I have been discharged from the emergency room with a 209 over 129 blood pressure. Them telling me there was nothing they could do and I needed to go see my family doctor. My family doctor wasn't open. And what am I supposed to do now? When it's months in between visits to a rheumatologist for my lupus, and they really aren't doing much about it. And then I feel like I'm crazy because I can't ever tell anybody anything about how I'm feeling or how to explain it to them. And then the world looks at me like I'm nuts. And I'm not. That's my biggest fear. That I am losing my mind, and I know I am. Keep checking for updates. I'll explain more about this whole phenomenon as it goes. Let you know everything you need to know about lupus from a lupus patient.